What would be your, say, three reasons why you may have seen medtech, which on the surface look like they're great, but they don't actually get any adoption in a hospital setting?
Yeah, I would say ease of use is really, really important. Lack of some sort of champion for change. If you don't have somebody in that facility that maintains that confidence in the product that you're using, or something comes, patients present in so many multitudes of ways that you can't always anticipate what kind of troubleshooting you're going to do. So if you don't have a champion for change in there that's going to help keep showing how well this product works, that's a huge deal. And then limited options or limited candidates that it provides resolution for. If you have a very specific niche, that may be key, but if you can reach a really large, cast a very wide net of who this is going to be helping, that gets a lot of supporters on board for sure.
Welcome to the H-Files, the new series of the Hands-On Business podcast, where we dive deep into the world of healthcare leadership and the unique challenges facing small to medium-sized healthcare businesses. I'm Hakeem, and after years of helping businesses grow in various industries, I'm excited to focus on the area that I know the best, healthcare, one of the most dynamic and impactful sectors in the world today. In this series, we're going to explore what it takes to lead and grow in healthcare, from navigating the complexities of regulation and innovation to overcoming the everyday hurdles of building a sustainable business in this fast-paced environment. Each episode will feature real-world insights, expert interviews, and actionable strategies that can help you push your healthcare business forward. So whether you're a leader in the space or an entrepreneur ready to break into it, the H-Files is here to give you the edge. We all know that bringing a medtech product to life is one thing. Getting it adopted by a healthcare system is something completely different and a completely different challenge. So in today's episode, I'm joined by Dr. Tori O'Daniel, a seasoned OBGYN and medical director with over 14 years of experience in obstetrics and gynecology. And Dr. O'Daniel has been instrumental in implementing new technologies and protocols within hospital settings, focusing on improving patient outcomes and streamlining clinical workflows. So together, on today's episode, well, I say together, I'm going to be asking the questions. Dr. O'Daniel's going to be answering those. We're going to delve into the critical question for all medtech innovators. How do you actually build medtech that get used? So welcome to the show.
Thank you.
Dr. O'Daniel.
Thank you so much. I'm excited to be here. I appreciate the invitation.
Excellent. So hopefully we're going to go through some of those key factors that every medtech company should be considering to succeed in today's competitive market. So before we get into the nitty-gritty of medtech adoption, I want to take you back to a moment, potentially early in your career, when a piece of medical technology either really helped or completely got in the way. If you can think of something like that, because I just want to explore what happened and how did it shape the way you think now about new innovations.
Yeah, I think that, I can't really pick a specific moment where I thought something just really ingrained in my brain about why it worked or didn't work, but it was kind of a cluster or a combination of things that I think either fell into place or just were really well thought out. And one of the things I would say that they either succeed or fail is based on sort of the timeline of how it works in your workflow. So if the product served a purpose that either there was a gap that we were not currently able to get any sort of resolution with, and it just filled that need for us in the moment, that sort of rises above. And let's say it was something that it actually served a purpose that was better than what's on our availability, or what I say, like the tool in our tool belt was working, but it could have worked better. So if it improved a process for me, that really, really made it successful. Its ease of use, and then just education about how it's used. I have been using devices really since the moment you stepped into medicine as a med student, and then as a resident, and now as an attending. If you don't have the whole team on board, that is really going to make or break you, even if it's this phenomenal thing that is life-changing. If everybody in the room is not familiar with what it's doing, how it's working, how their part in the piece of the puzzle works, it really can break the system flow for sure.
Okay, so in terms of, from your experience, what you're saying is, or let me ask you if this is what you're saying. So what are the most common reasons medtech products fail? Is that because either they're not easy to use or they don't have the education. What would be your, say, top three reasons why you may have seen medtech, which on the surface look like they're great, but they don't actually get any adoption in a hospital setting?
Yeah, I would say ease of use is really, really important. Lack of some sort of champion for change. If you don't have somebody in that facility that maintains that confidence in the product that you're using, whenever something comes, patients present in so many multitudes of ways that you can't always anticipate what kind of troubleshooting you're going to do. So if you don't have a champion for change in there that's going to help keep showing how well this product works, that's a huge deal. And then limited options or limited candidates that it provides resolution for. If you have a very specific niche, that may be key. But if you can reach a really large, cast a very wide net of who this is going to be helping, that gets a lot of supporters on board for sure.
And obviously, healthcare system, they're always strapped for cash. The American system is slightly different because obviously it's not the same as the social healthcare that we have it over in the UK, but cash is still important. So how important is that if you've got all those other things? So you've got the education, you've got ease of use, you've got a champion for change, and it does cast a wide net across everybody, but it's very, very expensive.
I could not agree with you more about asking this question, because I feel like to narrow this down to three things about positive, like failure or success, is hard. But that would be competing for a top three slot. For certainly, if there were top five, it would be in my top five. And I think depending on where you're at, that cash or cost rather could be number one. And so it depends on what system or region that you're in. It depends on, even within the United States, whether you're in a maternal desert where you have less cash flow or option, and or if you're in a large tertiary center. It just depends. It's always a key factor. It's always a discussion that you're going to have with hospital administration to make sure that we're not bringing something in that we could have solved in a way that did not require a device and then also cost so much to the system, because there's already so much cost to the
Yeah.
system. That is always a key factor that hospital administration is going to ask right off the bat. And if I can show long term that the cost of the device decreases my overall cost because of other long-term sequelae, whether it's blood transfusion or requiring a longer length of stay if I don't implement this device, or perhaps that means the baby might be in the NICU if there's so many factors that play into what cost actually means, if it's upfront cost or if it's long-term cost. It's always a discussion. So it's a huge deal.
And yeah, I'm glad you mentioned that second bit, because I think sometimes when people hear the word cost, they're thinking about unit cost. And I think what you've just talked about, the cost in use, the value that it brings to the system, not just, it's cheap. Because I think some people think, it's cheap, so everyone's going to want to use it. And well, not necessarily, especially in maternity, because as soon as you have, even if you've got a cheap product, the number of births that you're having per system, it ramps up very, very quickly if it's not really doing anything over the long term. So I think that's a really important point to reflect. And then, I mean, we obviously met through maternity products. And I was surprised, as a man, to be honest, as how much people don't really see obs and gynae as important as some other areas. So I was just curious whether that cost issue, when you're in a system, do you have to work harder if there's a really good product to be able to demonstrate that it works than if you're something like in men's health, for example, and it's a prostate product?
Wow, you're just speaking right to me. Yes, yes. That is the understatement. That's understated question of the decade, honestly. Women's healthcare really has not had a ton of innovation in the last 20 plus years. And part of that is the way that reimbursement and costs accumulate for women's healthcare, specifically maternity care. It's all under a global package. And so there's only so many pieces of that pie, right? That's frustrating on our part, because we just want to make sure that we're taking care of patients well and safely, and doing so in a way that those of us caring for them get reimbursed for the work that we're doing. And, that goes way beyond 9 months or 10 months of a care, right? Prenatal and then postpartum, that fourth trimester care is huge. So I feel like we're always fighting to justify in a way that feels harder. Now, clearly, I'm speaking from my perspective because this has been
Yeah.
my entire career, but it feels like we're having to justify the cost when it doesn't feel like reimbursement on a hospital or even a physician side is, they don't meet. Those two things don't meet very well.
Yeah. So what can medtech companies and medtech innovators do to help you? So before they come and present a product, what can they do that if you see it and think this is brilliant,
Hmm.
you're going to have to go and fight for it. You're going to have to go and fight for budgets and reimbursement and all that sort of stuff. So what can they do to support in that journey so that it makes it a lot easier for you?
Yeah, I think showing that it improves patient care, a big picture is huge. It improves patient care in the sense that it does affect the end number. The bottom dollar for all people involved is improved based on the use of this. And then sometimes helping, and I don't really know where in the process because this is a little bit more behind the scenes than even I'm a part of, but part of the process that helps us understand what kind of codes or modifiers that I can actually use to be able to use this product that justifies that what I'm doing required an additional need for device and why this was important and how I can then show that that additional need or modifier in my billing process worked and justify it. If you help with that, that's huge from a physician side.
So effectively justification. And if that justification always going to, because obviously value analysis committees,
Hmm.
etc., are they all looking at the same things? As in, I'm just starting from a device, a company's perspective. Can they almost have a template which they would use to present to value analysis committees, or does that change from system to system?
It's pretty, I think the template is probably a really helpful thing. It's all, there's always
Mm.
some variances depending on what facility and how the facility analyzes what system, or I mean, what device they're going to implement. Some smaller systems just require an interest from a physician saying, hey, I've seen this at a conference, I've used this, I've simulated, I used to use this at my other facility. And then that hospital will say, okay, yeah, let's do a trial. Or there are some very large systems that require a very regimented, okay, I need this template. I need to see how it fits into the algorithm. How does this cost affect the overall system? And if we're going to do this, do we implement it and then send it out to all of our branches across several states? So I think in answer to your question, a template is always good because then it always shows me how other places have done it. How does this work in their cost analysis? And then if I present that to my team or my committee at my hospital, that just helps, gives me evidence to say, I also have this component, but I see how this affects patient safety and I know that this can affect my patient care.
Okay, yeah, that's really helpful for people listening and watching. And then in terms of, I've seen this almost quite regularly with, especially small startups or clinical innovators. They have a perceived clinical need, or they believe there's a perceived clinical need, and they just start producing the product, and they go down, and then they start presenting it to people, and they can't, even though people aren't particularly interested. Because it's their baby, it's like, well, I'm going to just keep going. I'm going to keep going.
Yeah.
So my question is, how does an innovator ensure they're addressing a real clinical need rather than a perceived one?
I think it's about exposing yourself to as many people that are on the ground working as possible. One of the things that was I say humbling, but I feel like I learned this really very early on is that the people doing the work are the ones that need to be spoken to. And that doesn't just mean physicians, right? My team, I've done a lot of simulating and educating in the past 20 years. And one of the things that has never stopped being such a resounding, like, this has to be a part of this, is that you have to have a team involved.
Yeah.
And so you have to not only ask physicians who are using the product, but you have to ask the nurses and the scrub techs and the people who are a part of this system that may be seeing a component of this workflow or algorithm that I don't see and they see, but I don't see. And then there's things that I'm seeing that they don't see. And together, when we simulate in my institution and when we simulate across the country and in our societies, we look at how this workflow works. And if I have a product that's fantastic, but I don't understand the pain point behind me because when they got it to me, there was all these pieces that I knew nothing about, then it's broken. everybody knows where the product is, how it's used, who's a candidate, how can you troubleshoot, how do we make this more this facilitating process so much easier? Man, that really can shine or just kill a product.
Yeah, it's
Yeah,
interesting.
for lack of a better term.
Yeah, no, I've had so many conversations with people just by my experience. Is that number one, the workflow? If you can get something that fits into an existing workflow, then you're already sort of kind of onto a winner, because nobody wants to start changing what they're doing. And then number two, exactly what you said about the teamwork. So many people, and I keep having this conversation with people, they look at the hierarchy and they say, "Oh, well, I'm going to go to Dr. O'Daniel because if I get Dr. O'Daniel on board," but then I say, "Well, she's got a team of people that all influence her. And if they're in the background saying, yeah, but this is going to be an absolute disaster for me doing X, Y, and Z," it doesn't matter how much she likes it. You know, she's likely to say, well, actually, I like the product, but actually it's going to cause my team too much of a headache, so I'm not going to go with it. And I think that's a real key area that lots of innovators and medtech companies don't even think about. They just come to you and think, right, Dr. O'Daniel likes it, job done, I don't need to do anything else.
Absolutely. And I say the more clinicians, the better, because the team is a huge component, but then the variations of the region or facility specific needs. You know, if this is a need that's only specific to a tertiary center where all of the high risk mass load of people come, that's fantastic, except for then what happens to those places that are medical deserts, where they don't have the same access. So their obstacles are different than where I'm at a tertiary center. And so if you could capture both of those things, where it works great in a small hospital or facility for your patients as well as a tertiary center, it helps me transfer, right? If I'm using something that then helps me appropriately transfer a stable patient, also a huge deal.
Excellent. No, that's very useful to know. And if you, I mean, you've probably got lots, and I don't want you to give any names, but can you think of an example where it's gone really well? I.e., someone's come to you with a product that fulfills a need, almost looking for an exemplified example of when it works well, and the things that went into that working well, and then that product being adopted. No names though.
Yeah, absolutely. Without giving specific needs, I think the products that I have been able to utilize across facilities. So to be clear, when you're at a tertiary center, that you're receiving transfers from anywhere, one of the big components is like, how do you give access to care to facilities or locations that don't have the same resources? One, how do you educate virtually / via phone when they make a consultation? Two, how do you help them stabilize for transfer? There are two components to that, because sometimes they call and they're getting advice from some of our smaller sites, and they're asking for advice about a product that they have, but maybe they feel like we're more well versed in. It's been successful when education has been at the forefront of what we're doing. So if you have an education piece that's not only given to the tertiary center, but also the small place, and then you have champions that may be using it more frequently at those larger institutions that then can walk these clinicians through a stepwise process, an algorithm, a checklist, what have you, that seems very much like a handoff. Sometimes those patients don't even need to be sent to me if they can handle the issue at large in their facility, because it's more about reassurance and understanding that you're doing it correctly. When I have a need at my facility,
No, so gone.
I have a multitude of resources, right? I mean, I can call in other clinicians very quickly because there's a bunch of us all the time. When those smaller facilities have an issue that maybe a device could help address, they may not even need to transfer if they can call me and get reassured that what they've done works, and or, okay, I've done these things, I still feel like I need to transfer. Does that make sense? It's like that communication piece in education is vital.
It makes perfect sense, because again, it's about understanding the flow of patients and how you're going to be involved in that, and how the other centres are going to be involved in that, because you want to make sure there's a consistency across the piece, rather than, okay, yeah, in the tertiary centre it's great when you're there and everything's working fine, but the people who are actually handing off are like, well, what's this that I've got to use, and I don't really understand why she's using this, and I've now got to try and get it. And that leads to a disconnect, because if
Yep.
people are uncomfortable to use it, the chances are they're just going to say, I'm not going to use it. They're not going to try and persevere with it. So I think getting that connection is important.
Absolutely.
And so again, I'm always trying to think about how can the medtech companies benefit from that. The more they can give you in terms of those checklists and understanding of that process, the better it is for you, because then you're busy doing your job. You haven't got time to be doing all the process flow.
Yeah.
So would you suggest that that's something that medtech companies should really be thinking about ahead of the game?
Yeah, I feel like if they have a solution, the best way to figure out whether or not the device that they've invented, created, suggests that should come into our solution, they need to figure out how it solves the issue for multiple people and where it fits in that algorithm for me. Sometimes the algorithm really is, I have this issue, this device solves this, done. Many other times it's like one component to the solution. And how does this fit into my workflow in a way that makes sense for me? Because that workflow, or that where it fits into that piece, may not always be the exact same, depending on what facility I am, what resources I have, or what the patient's presented to me. So if a device company thinks through this, understands that there might be different pain points for different people, they've spoken to enough clinicians and team members, nurses and techs, and all of those people combined, and say, okay, we've identified that maybe in a rural setting, this might be an issue, and in a tertiary center, this might be an issue, and this device solves those problems in different ways, in different components or places in that algorithm. That thought out process, honestly, would be so much more helpful that you've thought about that, and not, I don't have to work that into my thought. Yes, this works, it seems like a good idea, but now how do I implement this into my team?
Yeah. And do you see, because what you're talking about is a holistic approach, and not just an approach of someone coming thinking, I've got a great product, I want to sell it to them, and then I just want to, okay, if they ask me for every time, because what I've seen is people then, they'll go in, they'll sell the product, they think it's great, and then it's your burden to keep saying, well, have you got this? Or I'm going to have to do this, rather than them coming and saying, look, this is I've spoken to millions of people, and these are all the things I think are the check boxes. Is there anything else that you can think of? And I'll go and work it up for you. That, to me, would seem a much more sensible way of doing it. It takes longer, but it's going to be more successful.
Yes, absolutely. And I'm going to keep saying this because this is the biggest pain point for me, is like education. You have to educate and show me how to educate and make it very simplified, reminders, mnemonics, things that in the middle, because, for me, it's all good or it's all bad, right? In OB-GYN, it's like fight or flight all the time. And especially as a hospitalist, that's kind of our vibe. Everything is an emergency. Everything's on fire all the time. I need things to remind my team and myself to remember. So we have algorithms and we have little mnemonics of stuff. That kind of education into how to make this super useful in my crazy environment, it does wonders for us.
And I was thinking about that. So in terms of the reminders, and I'm just trying to help people out, where would be the best place to put those reminders? Is that in the labor room? Where's the best place for that to be?
It just depends on what the solution is, but often there can be little posters that go in the labor room. We have badge buddies, which are little things that go onto our lanyards with our name tag that have little reminders about a checklist, and we have that for lots of different processes, but also for device that we might use.
Okay, yeah, that's very helpful to people, because I think everyone can deliver those. I would hope. And then, because obviously we've been talking about almost the end of the process in terms of, okay, I've got a product, I'm coming to see you, and then we're looking at how do we get that adopted, which is important. But what about taking a step back? How important is it for medtech companies to actually involve clinicians in the earlier stages when they're designing it and testing it, to make sure that actually they're getting something that is viable and something that people see a need for?
Well, I feel like that's a huge part, because sometimes what seems like an easy solution, there's a component or a part of the device that they didn't even think about. Like, okay, this solves XYZ, and then they put it in the hands of a clinician, and then the doc will look at it and say, well, I can't, like, this doesn't actually work with my hand, or this doesn't fall exactly the way that this needs to. Okay, or this isn't going to work on the patient because of XYZ. Or so I think those initial steps, just to capture people's actual experience with patients and get the product in their hand, get the feel of it, see how it works on a patient, see how that actually works in the flow of if I'm operating, if I'm doing laparoscopy. I mean, all of those components of that, you could probably knock out some obstacles before you get too far down the line really fast, just by putting it into as many people's hands as possible.
And that's a really important thing you do, because what I've seen is actually the worst people at doing this are clinicians who've developed a product, because they think, well, I'm a clinician and I've tested it myself, so this is brilliant. And you're thinking, okay, so how many other clinicians have you tested it with? Well, I don't really need to do that because I do these operations, or I do this procedure every day and I know it works. So what's your advice to those sorts of people?
Oh man, I mean, just if any of them could think about physician inventors, we tend to assume that look, we get in this bubble that everybody's doing this something the exact same way. And I just encourage thinking about residency, where we trained, where you have a way that you do things. And people often will say, well, this is the way that I was trained. This is how I learned in residency. And if you can think about how different you felt, or how fish out of water you felt when you went to a new facility and you asked for something or an instrument, and that entire OR looked at you like you were crazy, and they had either never heard of that instrument, or they had never heard of that instrument being used in that particular case. So if they can think about the fact that there are a ton of ways to provide similar care, they need to see what everybody else is doing. Because as soon as you go to a different facility, there are little nuances of change that may not be exactly how everybody else is doing it. So having those think tanks with 4 to 5 docs, nurses involved, looking at the product and saying, oh, that's great, but that wouldn't work at my facility. And here's why. Because you need those different perspectives. So don't get too big for your britches. Don't assume everybody's doing it the exact same way. If you are around anybody else that's across the country or world, you can recognize very quickly that we all do things a little bit differently. I've taught for global conferences, and I've been asked questions where they've brought up a question to me, and I've actually been a little stumped for a minute and said, wait a minute, let's step back. Can we walk through your process? Because I have no idea what you're talking about. And then I feel like, man, we're both doing the same job, but yet we're doing it so differently.
I think, it's what you said, and it's about opening everything out. I think sometimes people are very myopic because they're so focused. It's like, well, I know this is going to work. It's got to work because I've invested a load of time on it. And in fact, I was speaking to I had Dr. Jonathan Sakir on the show, who's a surgeon and an entrepreneur. And I can't remember what the product was, I have to remember. But he said he had an idea for some surgical tool, and he thought it was brilliant. And he said, oh, yeah, I'm going to make millions. And then he spoke to a couple of surgeons who were friends of his, and they said, why would you waste your time doing that? This is not the process that we use. You're not going to make any money. And he said it saved him a lot of time and a lot of money just having that conversation with us. Because in his mind, I'm a surgeon. I would use it. Everybody's going to use it.
Yep. Yeah, so it's so funny. It's so true. We get a little bit narrow-minded, and not intentionally. Egos are not always involved. Sometimes they're involved, but I don't think that egos are involved as often as one would think. It's more just like you just start to tunnel vision, and you just assume the problems that you're having are exactly how they are in other institutions. And sometimes you're right. Sometimes it's a huge global issue, and sometimes it's not. It's a facility issue, and so then that's not a product device need. That's more of a systems issue that you just fix the workflow.
Yeah, no, exactly, and I think that's important to actually to understand the difference rather than spending all. I mean, and I've spoken to quite a lot of clinicians when I've been selling products, and I remember no names, no patch, but I remember selling a product and someone ringing me, the clinician, and he said, "Oh yeah, we've got this. You've probably got some competition, and it's a clinical innovator." But I'm going to test it and then I'll get back to you. And then they got back to me about 2 weeks later and said, don't worry about it. It's rubbish. And I'm going to tell her, and I'm going to tell the innovator. I said, well, don't be too harsh. She said, no. She needs to know it's rubbish because there's no point in wasting any more time on it. And I thought, oh, that's a bit harsh, but it is. Sometimes it's you have to be cruel to be kind, because you don't want someone to spend lots of time and money developing a product just because it's their baby when it actually there's not really a market for it.
Absolutely. That's hard to have a conversation when somebody has put so much time and passion into it, which is why I think what you asked is so key, is getting more people involved at the beginning can really help your success and understanding if this in fact is an issue for more than just yourself, for sure.
Yeah, definitely. And we've spoken about one end of it in terms of the what's it called, the success, success story. But often you learn more in failure than you do in success. They say, although I still prefer to be successful more times than not. So can you give me an example of and again, no names, a product that's been introduced to you and it's been an absolute disaster for one of those reasons that you mentioned, maybe not buy-in, maybe no education. Can you just think of one of those, because it's useful just to put it into context?
Yeah, I think the things that I feel like have been more of a disaster for me is like they said or promised that it would fulfill a need that it just didn't. Like, it didn't produce the way that they said it was intended to work. So they told me that there was a gap, and I agreed. Yep, we definitely need something in that arena. And then we trialed or used it, and it just fell short. And so overpromising without having done your due diligence and making sure that it actually produces or fills the gap that exists is huge. And then, the feedback. So the follow-up, when you've asked me to trial a device and I've trialed it in my facility, and then I give you feedback and you don't well receive that because you're so frustrated that it didn't actually do, or I just am having an issue. You have to have thick skin in this industry, which is hard when it's your baby, but taking the feedback and also actually coming back for feedback. I've had people have us use devices or technology that didn't ever really get a whole lot of feedback from us, which I find ironic, but get a whole lot of feedback about whether it worked, maybe because they didn't want to know if it worked, or if they came back and they did not well receive the feedback that we gave that I felt like was more just constructive. Like, hey, I think I would improve these things because that would help the success of the device. So yeah, falling short of expectations, not receiving the actual critical feedback, I think is key to success, in my experience.
And that's a really strange one, isn't it? That the feedback thing, because you'd think that whether it's good feedback or it's bad feedback, I'd almost argue all feedback is good feedback. Because if the feedback is it's not that great and you need to do these things, then there's a decision to be made. Do we do those things because we need to invest in changing it, or do we just say, actually, we haven't got the money or we haven't got the desire to make those changes, so we're just going to cut our losses and do something else? But either way, it would seem very strange that you give a product to someone to test and you either don't ask for the feedback, or when you get it, you say, oh, well, yeah, you may think that, but we're going to push on regardless. Okay,
Absolutely.
push on.
It's amazing. It's amazing that people do that. And I'm not ever, I agree with you that all feedback is good feedback, although some feedback is harder to receive than others. But if we've used it and multiple of us have used it and we have very similar feedback and just suggestions for change, and you sort of downplay our concern and be like, oh yeah, I don't think that's an issue for anybody else. I'm like, okay, well, it may be. And so just receiving the feedback and then maybe prioritizing the feedback and what we can do, or saying, okay, we've heard this. I've not heard it from anybody else. Can you tell me when that occurred? What was happening when so that you can troubleshoot with me? That's huge. I caution people to assume that all feedback that's critical is not going to be beneficial for them in the long run.
Oh, and I've had this conversation with so many companies. So we have to do more and more studies. I said, look, you are aware that yes, you do have to do more studies, but you are aware that just doing studies does not mean that everyone's going to say it's brilliant and you can launch it immediately. I said, you have to do studies. You have to be aware that there may be some negative, and therefore, if you haven't got a budget to then make some changes, then maybe you don't want to be trying to launch a product or launching another iteration, because not all feedback is going to be, this is, where have you been all my life? I've been just sitting here waiting for you to come through that door with this product. It's
absolutely.
So yeah, so I think that's a really important point. So just, and I'm going to come back to the VAC because this is an area that people get really nervous about. I found, no, I've got to get to the VAT committee. What I'm going to do. So when you're on the VAT committee, and we talked about the justification, what are the key things when you're sitting there as a medical director, you're on the VAT committee, and a product comes in that's not been endorsed by you, it's been endorsed by somebody else? What are you looking for?
A broad, like a wide net. Who are we
Yep.
reaching? Am I going to be able to reach a maximum amount of people? And now that I've been working with hospitals as long as I have, a key component of that is cost, and it does
Yep.
affect who it's going to be able to reach. Ease of use is a huge component of this, and I would say, in addition to that, follow up of use. So, in service training, making sure that we're all comfortable using the said device is huge for me.
Excellent. And so if that, I'm just thinking about that follow up. So that, because I know certainly when I put products in, then we always go in with an education plan, as in, this is how we're going to roll it out. We're not going to just dump it in there. You've got 5 facilities. Well, let's start with 1. Let's train these people. Then once we've got them on board, then we train someone else. Because I think lots of people always think, oh, well, they've got 5 facilities. We just got to train everybody. And that tends to lead to bad training or incomplete training, or the inability to do that proper follow-up, because I'm training here and I'm rushing to this place over there, and then they've got issues, but I haven't got the manpower to deal with that issue.
Yep, absolutely. And it's a little scary thing in my industry to have learned. Like, I learned some great things in residency. I had a fantastic training in my residency, but we need to be more open. And I think MedTech needs to do a better job of making sure that they understand. I need to make sure that not only you're using this device, but you're using it safely, right? If it's filling a gap, the safety has got to be at the forefront of using the device. And there is a barrier with education coming from device, because you don't want to influence somebody's use of the device by MedTech's presence. But if they are the experts, then you need to teach clinicians how to be the experts, and then help empower those clinicians to also then be the teachers, to maintain the level of competency in whatever that you're using. And there's always turnover at hospitals. There's also different places where you can train, but rolling out a system that you can educate, follow up on the education to make sure that everybody understands how to use this safely, really, in my opinion, is like the top tier for why something would be continued to be used or not.
And what's the best way you've seen that happen? Because most medtech, especially when it's a surgical intervention, want to get into the surgical setting, partially because they want to help train, but partly because they want to influence the process. So from your point of view, because I'm always trying to look at because I can always look from a medtech point of view, but from a clinician's point of view, what would you say is the best way that you think that gives you that impartiality, but also gives you that actual level of safe training that you feel confident that actually I can now actually implement it, but also deliver that training to other clinicians?
You have to give multiple avenues for training. So you have to do in person, you have to meet people where they're at, whether it's night times, weekends, whatever their schedule looks like. And you have to have different forms of communication, whether it's a badge buddy, if it's virtual training, if it's virtual and person. You have to give me lots of options to learn. And then making sure that whatever clinician that you're teaching first, those people should be your champion for change. I mean, I did not coin that phrase, but I have used that over the last several years, because watching simulation, I recognize very quickly when you have a nurse practitioner, a physician who has really seen and believes that this device is changing lives for the better, then you have those physicians for change, or champions for change rather, that really do advocate for the use of something that they know is beneficial. And it's so important as a med tech to teach. But you're right, you're not always in those settings. And sometimes those settings are spontaneous, and in the moment of crises, you have to have those people at those facilities that can comfort somebody who may be using that device and say, okay, I don't really actually remember these steps. And somebody steps in and says, I know how to use this. Let me show you how to use that. And from my perspective, that has been so helpful as a hospitalist, because OB hospitalists actually are in-house. And so if another doc needs a hand, I'm already there. It's not like I'm calling somebody in special. I can go help with that. So those champions of change really, I think, can make or break whether or not a system becomes comfortable with using the device. And that education has to start from you guys, because you guys
Yeah.
show us how it works, you help us roll this out, you meet us where we're at, and then you do follow up and do re-in services and help provide any additional support that I need.
And just on that one, because I train a lot of people on the champion for change. How do you identify a champion for change? I'm talking about so from a medtech point of view, because lots of times, and I have a very clear distinction between a positive person and a champion for change. And every time I go into businesses and I say, right, well, who's your champion for change? They'll tell me about a positive person. I say, right, okay, so what have they done to help you? Oh, well, they love the products. Yeah, but what have they done to actually help you? Are they speaking for you? So how would you say, from your point of view, you identify that champion for change rather than just somebody who, yeah, I like the products, and then the med tech company runs off and goes, yeah, they love it, great, they'll get it in. Well, not necessarily.
Yeah, it's a fine line, right? And sometimes you find those diamond in the roughs that happen to be the same person. The positive person is
Yeah.
the champion for change, but they don't always align. I think you ask who makes the decisions about products, who gets the door open, because it's different everywhere you go. It's not always the medical director. It's not always the section chief. It's not always the chief medical officer. I think it really just depends, and you have to break those barriers down to go into that facility and say, I believe in this product. I think it can make great change. Who do you need? Who do you see needs to sit at the table with me so I can have a conversation with those people? And I think the positive people, even if they aren't the ones that are going to be making the change, because they're positive people, they use products, but they don't have the time, energy, or really option to be able to go in and say we need this product. You need the positive people, but you need the people who are actually the decision makers at the table. And once you get in to know the facilities, they'll tell you pretty quickly who you need to speak
Yeah.
to get those movements going in the right direction. At least in my experience. I mean, it's not always easy. You can't expect those questions to be answered as soon as you walk into a facility, but I think if you invest time and energy into showing them that you believe in what you're giving, they'll have those discussions sooner rather than later.
Yeah, no, and I agree, and I always say to people, don't just look at an organogram. Look at the
Yeah,
person who's the most
exactly.
senior and say,
Exactly.
right, that's the person who's going to get. Yeah, it may well be that person, but often it's not. They are obviously an influence and they have an
Uh-huh.
influence in it, but they may not be that champion for change that you need. And actually, often the person at the top isn't the champion for change because they're so busy, they haven't
Absolutely.
got time to be
Absolutely.
doing all this stuff.
Yeah, and they don't even know. I mean, to be totally frank but respectful, is that some of those people at the top are managing so many things. They're at the
Yeah.
peak of the mountain, but they don't know why this product actually would be helpful. So they're leaning on those people that are underneath them to really come to them and say, "Yes, this is it, right? I want this device in my facility." And I have been the champion for change a few times because I have been out at other society meetings or conferences. I have seen something, I have simmed something, and people that I trust are using it in their facility across the country. And I'll say, "Oh, I don't even know about this. Why are you using this device?" And then we will go through it. They'll explain it to me how it works in their facility. I'm like, "Okay." So then I bring it back to my facility and then I say, "Hey, I really want us to use this product because somebody that I trust is also using it." And it doesn't mean that the data isn't relevant. Data is super relevant in what we do, but anecdotal information, personal experience, people that we trust that know are using it, that's also huge. And those networks in medicine are small. It seems big, but those networks are small. And so making sure that you talk with people who know other people, that's a huge part in just discussion about making sure that we're doing the right thing.
Yeah, no, I've definitely seen that. I mean, and actually, as I've when I've been in the States and you're going across the hospitals, a lot of the times people such as yourself will say, "You need to speak to that person. Have
Uh-huh.
you been to that? Have you been to that system? Have you spoken to that? Do you know that person?" And they,
Mhm.
so you start once you start working the market, you start to understand the
Then you know.
networking,
Yep.
and then you think, right, I've got to speak to her, I've got to speak to him, I've got to speak to that person. Because if I can get that person on board,
Yep.
then I've got a whole network that opens up for me rather than going to a facility where there's no network and well, yeah, they might like it, but they've no influence on anybody else. Unlikely, but
Absolutely.
I think that's really important. So I can't believe that 42 minutes have already gone. I've no idea where that's going. I'd booked this in for like 35 to 40 minutes and already because I really enjoy the conversation. Yeah. So what's really coming across to me is that education piece and the piece about making it easy for the clinician, so identifying the champion for change, making it easy for that champion for change to actually champion the change within their facility, and actually understanding who else is in that whole process, and that you understand the workflow. And it's interesting actually, because I can't remember which business it was. There was one company, and all they did, I wish I could remember the name, all they did used to go into hospitals, and they used to sit there and watch your process. So they could say, issue there, issue there, issue here, issue there. This is how you develop a product, because this is a massive issue, rather than, oh, I've just made up a product because I think there's an issue. So if there was that 2 or 3 pieces of advice that you could give, just to wrap it up, in terms of advising a medtech startup today, which are kind of like non-negotiable elements if they want to get that product adopted, what would they be?
Well, I hate to sound like a broken record, but I think that making sure that whatever product you come up with is easily, you're easily providing education for that product is huge. Like that to me, I think I've just learned from experience that really does speak volumes. The first I think would probably be the obvious, is it has to fill a need. It has to fill a need that either isn't being filled very well or just isn't being filled at all. And I think the other non-negotiable that you brought up that really is going to create some hindrance is cost. It has to fit into the cost of whatever you're fitting that in to, and then having a team on deck to be able to follow up with that feedback coming up, making sure your education is on point, and making sure if we've missed the mark a little bit, how do we adjust and pivot into a broader version 2, whatever you're doing.
Yeah, flexibility, in other words. Absolutely. And actually, as you said, actually listening to feedback would probably be a decent and reasonable idea, rather than just thinking, I don't care what she said, I'm just going to carry on, which madness.
Yeah, in all transparency, I think all of us have a little bit of ego that is good. It helps provoke you. It helps you get you moving in the right direction and gives yourself some confidence. But if you let your ego get in the way too much, then you just miss all these other brilliant people around you that have really good little nuggets of information. And I have learned that in lots of ways in my life, not even in just medicine, but just, let your ego force you to move in the right direction, but don't let it cause you to miss all the signs around you, for sure.
Thank you very much. So Dr. Tori O'Daniel, as I knew it would be, it's been very informative and very enjoyable even, and the time has absolutely just flown by. So no, I really appreciate you sparing the time in your busy schedule to come on.
Yeah, thank you for having me. It was lovely chatting with you. I can't agree more that I can't believe that this was already 45 minutes of conversation.
Thank you very much. As a famous Prime Minister of the United Kingdom once said, education, education, education. And that was the thrust of what Tori was saying, that if you want to get a medical device product adopted in a medical system, yes, there are other things that you need to take into consideration. And she gave us her top tip in terms of it has to have a wide net. It can serve a wide population. The cost has to be good and it has to be easy to use. But Tori kept coming back to the fact that even if you have those things, education and getting into the hands of the clinicians and understanding the workflow and making sure that there is an education program in place is key if you want to get that product adopted. And don't forget to pick up the show notes over at thesalesaccelerationformula.com/podcast/show-notes. You'll also find an option to subscribe to our mailing list so that you can get notes for every single episode straight to your inbox. While you're at it, don't forget to tune in to next week's episode of my new 5 in 5 series, where I share 5 actionable takeaways in just 5 minutes from this episode, which will help you supercharge your business growth. Don't forget to subscribe, like, and share this podcast with your friends, colleagues, and anyone else who might find it valuable. Most importantly, keep the feedback coming so we can keep improving and bringing you more of what you love. Thank you very much for tuning in. And remember, keep listening, keep growing, and keep thriving.